Okay, the recording has started. Good morning, everyone. My name is Martina Lennon. I am the General Manager for Loudmead Mental Health Services. I am delighted to welcome you here to the launch of Connecting for Life Midlands Loudmead Mental Health Service Local Action Plan 2023-2024. It is great to see so many of our partners and stakeholders here today. I'm just trying to figure out the numbers. I just can't see the numbers. 51 participants so far. And ye are all committed to working with us in the implementation of this action plan. This is the next important phase for Connecting for Life, and my colleagues will cover this later. Can we put it to the presentation slides, just not the, thank you. Thank you. Before we go to the agenda, a few housekeeping rules. I would ask that you would all go on mute so to prevent any feedback or interference. There will be a question and answer session. So if you have a question or comment, please type in the chat function. You will see the chat function as a speech bubble on your top right-hand corner of your computer. And finally, I will try my best to keep the presenters to their allocated times, and we should be finished about 11:40 this morning. So I'll go to the agenda. So I have done the welcome piece, and as I've said, I'm Martina Lennon. Next, we will have the opening address, which will be given by Anne Kennedy. Anne Kennedy is the Head of Finance for CHO8, and today she is the Acting Chief Officer. Following on from Anne, will be Dervla Ayres, Head of Mental Health Services, and she will be introducing this Connecting for Life programme. Next, we'll have Claire Donnelly, who is the General Manager for Midlands Mental Health. Claire will introduce the steering group and the resource officers for suicide prevention. And after the presentation, Claire will facilitate the question and answer session. And finally, we'll have the closing remarks. But before we go to the opening address, the presentation may contain sensitive content or discussion relating to suicide or self-harm that some people may find triggering. I ask that you are mindful of your own needs, take a break, opt out and return when you're ready. And afterwards, please be mindful of your own self-care and be kind to yourself. I will now ask Anne to open the launch. Anne?
Thanks, Martina. So welcome everyone to the launch of Phase 2 of Connecting for Life Midlands Loudmead Suicide Prevention Action Plan 23-24. The plan will provide a structure through which to sustain and continue to build on the existing suicide prevention initiatives and services. The activities as set out in the plan will be reviewed and updated to take into account new and emerging developments over the next 2 years. The plan has been designed to complement other national policies relevant to suicide prevention, mental health and well-being. It was developed in line with the strategic objectives and actions as set out in Connecting for Life, Ireland's National Strategy to Reduce Suicide 2015 to 2024. It also reflects a number of the principles outlined in Sharing the Vision, a mental health policy for everyone 2020, particularly recovery-focused integrated mental health services. The COVID-19 pandemic has presented many challenges and changes across health services and communities. It's been an extremely difficult and emotional time for many. Suicide prevention will be a key priority as we emerge from this pandemic. I would like to extend my sincere thanks to everyone who contributed to the development of the plan and who will now support its ongoing implementation. Thank you.
Thank you, Anne, for the opening address. I will now ask Dervla for the introduction of the Connecting for Life programme. Dervla?
Thanks, Martina, and thank you, Anne, for attending this morning. And I want to thank everybody, all 55 of you. I think that's a real testament for our commitment in Midlands Loudmead in terms of reducing the number of people who lose their life by suicide. It's really heartening to see 55 people to attend an online launch and not face-to-face. So I appreciate every single one of you. With that, I'd like to say that every death by suicide is a tragedy, and the impact of suicide on families and communities is deep and prolonged. The range of risk factors for suicide is wide-ranging and complex, and therefore actions to prevent suicide also need to be broad. Our Connecting for Life for Midlands Louth Meath, which spans the 6 counties of Laois, Offaly, Longford, Westmeath, Louth and Meath, has been developed to ensure our local actions and outcomes are aligned with and responsive to the national strategy, whilst also being cognizant of our own local and regional needs. While the HSE will lead on the implementation of Connecting for Life, Midlands, Louth and Meath, by-county local implementation groups will be set up to implement and deliver in an integrated and coordinated way on the commitments and actions of our Connecting for Life, Midlands, Louth Meath implementation plan. I wish to express my appreciation to the members of these groups and look forward to all sectors, services and communities working together in a unified and focused way to reduce the loss of life to suicide within the counties of the Midlands and Louth and Meath. Thank you very much. I'll hand you back to Martina.
Thank you, Dervla, for that introduction of the Connecting for Life programme. Now I will ask Claire Donnelly, who's the General Manager for Midlands Mental Health Service, to introduce the teams and our resource officers for suicide prevention. Over to you, Claire.
Thanks, Martina. Good morning, everybody. So I just want to introduce you to our implementation group, which consists of 4 of the general managers in CHO8. So Martina and I represent mental health. And then we have Mary O'Hare, who is the General Manager for Health and Wellbeing, and Grania McGill, who is one of the General Managers in Primary Care. And then our very important resource officers for suicide prevention, we have 3. We have Josephine Rigney, who is in Laois Offaly, Rosaline Dolan in Louth Meath, and then Patrick Jones in Longford Westmeath. So just to give you, just to give you an idea, an overview, I'm sure most of you are very aware of Connecting for Life at this stage, as many of you will have been involved in the previous implementation plans in your own different groupings and partner agencies. So Connecting for Life is a whole of society strategy to coordinate and focus our national efforts to reduce the loss of life by suicide. It's broken down into a vision, outcomes, goals and actions. And to just look at the vision here, it would be that to have an Ireland where fewer lives are lost through suicide and where communities and individuals are empowered to improve their mental health and well-being. The specific outcomes then would be to reduce suicide rate in the whole population and among specified priority groups. And this is something that's really been stressed in the latest iteration of the plan. And to reduce the rate of presentations of self-harm in the whole population and among specified priority groups. So I guess just to give you a little bit of the background, and this is really going to be fleshed out in more detail by the resource officers, but Connecting for Life 2023 to 2024 is built on the previous implementation plan. So we started off in June 2015 with the original plan being instigated, and that was published in 2017. It was rolled on, and due to COVID, there were lots of kind of things being pushed forward. We had the interim strategy and review in 2020, and that really has informed the production of the national plan for 2023-2024. What the review found was that we had made significant progress in relation to a number of issues, such as stigma reduction and self-harm initiatives and interventions, public health communications and media monitoring, early intervention services, coronial processes for registration of death by suicide, and GP prescribing areas. So that was the positive news from the review. The review also identified areas requiring further attention, and that would have included a more coordinated delivery of suicide prevention and training, and to have strategic planning around the priority and vulnerable groups, particularly post-COVID-19. The next area of identified for attention would be restriction of access to means in public places, and we will be working with our partners on this. And then finally, the evaluation of the cost effectiveness of the strategy. after the vision and the outcomes, we look at the goals, and these goals are divided into 7. So I'm going to go through them briefly, and you will get a more detailed version of these from the resource officers for suicide prevention. So number 1 is to improve understanding, and that means to improve the public's understanding of suicidal behaviour, mental health and well-being. Number 2 is to empower communities. So that's taking local communities and giving them the support and the capacity to prevent and respond to suicidal behaviour. Number 3 is a focus on priority groups, as I mentioned previously, and this version of the implementation plan will really target approaches to reducing suicidal behaviour and improving mental health among priority groups. The 4th goal is better access to support. So that's looking at improved access, consistency and integration of services and care pathways. The 5th goal is to provide high quality services, that's safe and high quality services that are evidence-based and really are effective in the pursuit of our goals. The 6th goal is to reduce the access to the means of suicidal behaviour, and that would involve working with different partnerships, whether it's statutory or non-statutory, in relation to this goal. And finally, the 7th goal is to provide better data and research, which speaks for itself. We cannot improve unless we know and can evaluate what we're doing. So within the plan, the national strategy has 69 actions which are aligned to these goals. Obviously, some of these actions will be implemented at a national level. They cross the entire country. And then within the CHO, we have our own 44 actions, which are aligned to the goals and to the national goals. And each of our resource officers for suicide prevention will now go through the different sections of the plan and give you more detail. So I'm going to pass you on now to Rosaleen Dolan, who will continue with the next section.
Thanks, Claire. So as Claire said, if we look at the goals in more detail, if we start off with goal 1, which is around improved understanding of suicidal behaviour, and you'll see there on the first slide all the different partners involved with this goal. But mental health problems are a major risk factor for suicide. So while there's a growing dialogue around mental health and well-being, people in Ireland are still hesitant to talk openly about their own mental health. So the actions under Goal 1 aim to bring everyone together to create an understanding of suicide, the factors that protect our mental health and reduce stigma. So this includes dissemination of information on services and supports, initiatives such as the continued rollout of mental health information campaigns to increase mental health literacy, and stigma reduction campaigns such as the Green Ribbon campaign. Development of pathways to care with GPs, promoting the importance of physical activity for our mental health, increasing awareness of drug and alcohol harm in relation to mental health, and support for local and regional media with regard to content relating to suicide and self-harm across print, broadcast and social media. If we move on to Goal 2 now, you'll see again the different partners involved, and Goal 2 focuses on preventing and responding to suicidal behaviour. So the actions under this goal include the implementation of this Connecting for Life plan, building capacity within community-based organisations to prevent and respond to suicidal behaviour, and working with the family resource centres with regard to their suicide prevention code of practice and building resilient community framework. Delivery of suicide prevention and self-harm resources and intervention training to community-based organisations, and delivery of wellbeing and mental health promotion programmes to the whole population and to priority groups. And those programmes would include stress control, engage and minding your wellbeing. So if we move on to Goal 3 now, which is around a targeted approach to reduce suicidal behaviour and improve mental health. So while our overall suicide rate in Ireland is lower compared to other countries, we do have particular demographic groups who are at increased risk of suicidal behaviour. So the actions under Goal 3 are in relation to targeted approaches to priority groups. So that said, it's important to note that only a minority of these groups will engage in suicidal behaviour. So the actions under this goal relate to interagency community response plans to respond to suspected suicides and/or suicide clusters. development of targeted initiatives and services for priority groups, for example, development of local crisis response plans for the traveller community. Improved support and training for individuals working with people presenting in suicidal distress, including those working in primary care and in the networks. And then collaboration with third level institutions on suicide prevention and the implementation of the National Student Mental Health and Suicide Prevention Framework. Supporting the delivery of early intervention and psychological supports for young people, and promoting campaigns that link substance misuse and suicide behaviour. I'm going to hand you over now to Josephine, who's going to explain the next 4 goals.
Thanks, Rosaline. So I'm looking at goal 4 here now. Goal 4 focuses on the services available to people vulnerable to suicide, with the aim of ensuring that they are accessible, consistent and responsive to the needs of the individuals seeking support from these services. Obviously, ensuring that transition points between the services are robust and operate under widely understood protocols and guidelines is important, so that the work of statutory and non-statutory service providers enhance and complement each other. The 7 actions in Goal 4 illustrate this focus. Reviewing the training requirements of mental health staff to ensure that there is a consistency in assessment processes and management. Exploring the possibility of expanding the SCAN service. Now, this service is the Suicide Crisis Assessment Nurse Service, which is available to GPs and Laois and Offaly for the timely assessment of patients. So obviously looking to expand that service throughout the CHO. Ensuring that families who are bereaved through suicide are supported in a consistent and more effective way through the production and the circulation of a guidance document, relevant information and provision of relevant therapeutic interventions. Continued implementation of the clinical care programme, thereby ensuring that all those presenting to our ED departments are assessed and supported in the most effective and efficient way, obviously with the aim of reducing the potential for repeat presentations. Looking at the transitions of care between mental health primary care and hospital groups to determine where improvements can be made, thereby ensuring that individuals are guided through a supportive network of care and assistance. And lastly then, providing awareness and training to all clinical areas and wards, etc. within our hospitals, so that staff can be more aware, confident and reassured in the support they are giving to their patients. Goal 5 then aims to ensure the provision of safe and high quality services for people vulnerable to suicide, both within the statutory and non-statutory services. It's essential that all agencies involved in supporting those vulnerable to suicide have good practice guidelines, clear care protocols and appropriate training and supervision mechanisms, thereby ensuring that the standards and strong governance structures are in place, obviously with the ultimate aim of ensuring that service users and providers are protected and the professionalism and safety of the service responses are enhanced. The actions in Goal 5 aim to facilitate this by dissemination of guidance documents such as suicide prevention in the community and dealing with a person in suicidal distress to all community organisations and groups for their awareness, information and upskilling purposes. Continued implementation of a system of regular reviews of incidents and trends within mental health services, with the aim of identifying potential service improvements in relation to suicide and suicidal behaviour. And obviously an ongoing emphasis on upskilling of teaching staff and staff in frontline positions such as Gardaí, TUSLA, Department of Social Protection, the local authorities and all community-based organisations, for example FRCs and social care and youth organisations. Goal 6 then aims to reduce and restrict access to means of suicidal behaviour. Research indicates that restricting, where practical, access to means of suicidal behaviour has been consistently shown to be effective in reducing suicide behaviour across settings, both at national and local level. So the aim of this action is to increase public health measures, to reduce potential suicide deaths in high-risk locations, and to increase the opportunity for appropriate interventions. Gathering the relevant data to facilitate this action will be required, of course, and we will engage with the relevant partners to enable this. And it's also important to be mindful of the impact of signage, both visually on the landscape and also on the individuals who may be seeing the signs. So being creative with the mechanisms of display, for example, maybe the use of QR codes on the signs, which are less obtrusive and facilitate easier access to the information. And finally, goal 7 then aims to improve surveillance, evaluation and high quality research relating to suicidal behaviour. Obviously, robust data is important in order to ensure responsive, cost-efficient and effective suicide prevention services. And this data relates to looking at the types of services and interventions that are effective. Data on the groups of people most potential to suicide, most vulnerable to suicidal behaviour. Data on the trends and data on key risk and protective factors. So the aims the actions in this goal aim to enable the collection of this data through the resource officers continuing to engage with our ROS colleagues around the country in relation to new service developments and initiatives, establishing a working group to assess the need and prepare a business case for funding the establishment of a real-time suicide surveillance system, such as it operated in Cork and Kerry by the National Suicide Research Foundation. And finally, establishing a working group within the Midland Allowed Mead CHO to collate all available information on suspected suicide deaths and suicidal behaviour, including priority group deaths. And then, finally, the last one is developing and implementing a monitoring system for our 2023-24 CFL action plan to ensure that effective and meaningful learning to influence future CFL activities and initiatives is developed and compiled. Now I will pass over to Patrick. We'll do musical chairs here.
Good morning, folks. So we've seen from my colleagues have talked about the various actions, the group leads, the various goals, and there's 44 actions that are attached to the 23-24 action plan for the Midlands Louth Meath. So how are we going to stay on track and how are we going to ensure that we progress these actions? So each of these actions are divided into a milestone that's set for the year, and each of these milestones are broken down into quarterly milestones. Now, the good news so far is that, Q1 we didn't have any actions that are attributed to it, so we were kind of, to a certain extent, are a little bit ahead of ourselves, but we have to start our work now in Q2, Q3 and Q4. So how are we going to achieve this? And this is going to be achieved through the implementation groups and also through the working groups. Each action will have, there is an action tracking template that will be sent out to each group, each lead agent that's going to be, I suppose, supporting or leading the action on that particular action. And each implementation group will return an action progress tracker to the steering group. And in that action tracker, it will state whether there was no action, and that's Q1, so we're on track. Then if there needs attention, so that's where there is an action, the work is in progress and any learning that has been learned for other actions. Then also if there needs action, that is where the work is not progressing, what are the blocks, who can help, is there learning from other actions, and escalation to steering group for guidance. And then if we're off track completely, then there is no progress on actions, there are significant blocks and escalation to steering group or senior management team or to NOS, the National Office of Suicide Prevention. And then the pieces there on that tracking template there, if you look over on the right hand side, you'll see that there's updates and there's notes. And the updates and notes are important to capture, particularly where there's progress and where there's significant work, because that is where the learning for other actions may come in. So if there's a group that's returning, needs attention or off track on a particular action, maybe we can learn from the information that's provided by the other group. So it's important that that section will be filled in. These action tracking templates will be returned to the implementation group 2 weeks prior to the meeting, and then that is also 2 weeks prior to the steering group meeting to allow time for discussion, allow for analysis of the data, and then so that if we do need to escalate something to NOSP or to the senior management team within that framework, we can do so. And this is the structure of the Connecting for Life implementation structure. As you can see, there is the implementation group sit just above the local area task orientated subgroups, and the working groups or the subgroups, these are action specific, and these will meet as agreed. So they could be looking at a piece around training, they could be looking at a particular community response plan, they could also be working on stuff around communication or any action that is deemed that it's kind of proposed that there needs to be progress on that action. They will report back into the various implementation groups, which are by county, Laois, Offaly, Longford, Westmeath and Loudmeath, and then these will feed back into the implementation steering group. And the implementation steering group may also have identified a number of task-orientated subgroups for particular pieces of work that they want to get progressed. And then they will feed back into the CHO Midlands Loudmeath senior leadership team and also into the National Office for Suicide Prevention. And there's an escalation piece here for if there are particular issues that are arising, then we can be escalated up for a bit of guidance and some support from the senior leadership team and from NOSP, and that they can also then feed back down if there's particular pieces in relation to research or pieces that may help with the actions within the area, that this information is then brought back down to the steering group, the implementation group and the working subgroups. I'm now going to hand you over to my colleague Rosaline for
No, it's me.
Josephine, sorry.
So I'm back again. Our first, we're going to introduce 3 key messages here. The first one is that suicide is everyone's business, and I'm sure we'll all agree that suicide is everyone's business. As a society, it is about reaching in when others cannot reach out for help, or offering it when we are concerned that someone may be at risk of suicide, and doing this at both an individual and a community level. As I'm sure we'll all agree as well, it is vitally important then that all those who are involved in social and healthcare networks work across our organisational boundaries so that people get the appropriate help and support that they need at whatever stage and what they are in their mental health crisis. For the purposes of the national strategy, when they were developing it, they undertook some research, and that research indicated that there was a list of certain cohorts or demographics of people who, due to certain risk factors and challenges being present in their lives, may be particularly vulnerable to the risk of suicide or self-harm. And some of the actions in this CFL action plan are targeted to provide extra support and assistance to these priority groups. As you can see, they cover practically everyone in society, and any one of us could potentially perhaps belong to one of these groups. And of course, these priority groups are also present in our CHO. And this again illustrates to us the need to be mindful of everyone and their experiences along their life journey, and it behoves us to provide a wide range of appropriate and relevant services at individual, community and services level. The Midlands Loudmeath CHO catchment area covers approximately 10,500 square kilometres in total, and as we know, it covers the counties of Louth and Meath, Laois and Offaly and Westmeath and Longford, and it includes both rural and commuter communities, which each present different challenges for health safe delivery. According to the census in 2016, there's approximately 620,000 people living in the CHO area, which is 13% of the whole total population of Ireland. And there has been a 4.5% increase in the population in the CHO since the census was done in 2011, which is higher overall than the increase in Ireland, which was 3.8%. And whilst the CHO has the 4th largest population nationally when compared to other CHO areas, it does have the highest number of children and young people under the age of 18 years. And there has also been a 21% increase in the number of people aged 65 years from the 2011 to 2016 census. And the demographics of the marginalised and priority groups as well, those perhaps who may be experiencing homelessness or members of the travelling community or members of the LGBT community, and also not forgetting the new residents who have come to live in the CHO from overseas, have also increased in recent years. And all of these provide additional challenges in striving to adequately provide services to meet the healthcare needs of everyone within the CHO. And hopefully these challenges are taken into account in this strategy, in also ensuring the vision, a mental health policy for everyone, and in Sláinte Care. As referred to earlier, the principal aim of the Connecting for Life is to reduce suicide in Ireland, with a 10% reduction in suicide rates adopted as the minimum target for the strategy, and that is a target set by the World Health Organization. Suicide statistical data is published in different stages from the CHO. First of all, there's a number of deaths are published, firstly based on year of registration, which is provisional. And you can see there on the slide, 2021 is our provisional rates, and the rate there, the number in that provisional figure is 399. Then they're revised later by year of occurrence or official or final, and these figures are compiled following investigation by the coroner's court. And then later they're revised again to include late registrations. So as you can see, the numbers are not easily comparable across different years, as at any given time the data for different years is at different stages. So from the slide here, you can see that 2020 is our latest official final figures, and that's excluding late registrations. And as outlined there, the number there is 465 deaths, 338 were male and 127 were female. And as I'm sure you'll all agree, it is important to have timely data, and in order to enable this, and therefore to be in a position to provide more responsive support to those people who have been bereaved, a national data sharing protocol is currently being developed. And the purpose of this is to enable more accurate and timely data to be shared between the post system within An Garda Síochána, the national office, and ultimately the resource officers. And this is progressing as hope to have the system in place in the coming months. And then lastly, the tables and graphs on this slide provide a summary of suicide data for the MLN CHO by county of residence of the deceased. These are calculated using the final years of occurrence data from the CSO and using the population estimates for each county from the 2016 census. The rates are crude rates per 100,000, and they also exclude late registered deaths. So as you can see, as is outlined on the slide, some of the county rates are below and some are above the national 2-year moving average. And so whilst the current available data, we get information on county of death, age and gender and the manner of death, that's very helpful and it's invaluable to directing our current work on suicide prevention. It does not allow for identification of additional risk factors in relation to suicide to guide the policy and service responses. And in order to help this, the National Office are working in partnership with the Health Research Board and the Irish Coroners in a project where they're looking at reviewing the coronial process to provide a more in-depth overview of suicide in Ireland than is currently available from the statistics that we get from the CSO. So now I'm going to hand back over to Rosalie.
Thanks, Josephine. Okay, so how can I keep you safe? Well, ultimately, everyone can make a difference in preventing suicide, as Josephine mentioned there. And the more people in the community who have suicide intervention training, the more likely it'll be that they'll be able to identify someone who may be vulnerable and intervene to help keep them safe. So to assist with this, and as part of Connecting for Life, we offer evidence-based training. And the aims of the training is to enhance awareness and develop skills to respond to suicidal and self-harm behaviour. So if we look at those training programs now, Live and Work Start is an online program that teaches participants to recognise when someone is thinking about suicide and how to connect them to help and support. And it's a 90-minute long self-directed learning program. Safe Talk is an internationally recognised half-day face-to-face training programme, and it supports participants to recognise and engage persons who might be having thoughts of suicide and to connect them with community resources or supports. Understanding Self-Harm, well, there are 2 courses here, and there's a 2-hour online introduction course and a 1-day workshop that helps participants to develop knowledge and understanding around self-harm and consider the needs of those who are self-harming. ASSIST stands for Applied Suicide Intervention Skills Training, and it's a 2-day skills-based workshop that equips participants for suicide intervention role. So the emphasis is on first aid. It's about helping a person who may be having thoughts of suicide to stay safe and seek further help. Suicide bereavement training is offered to professionals and key contact people to understand the grieving process and in the context of suicide, and the key elements to support someone bereaved by suicide. And then STORM is a skills-based training programme of risk management for suicide prevention. It aims to develop the skills of frontline workers in mental health services to assess and manage a person at risk of suicide. So on the next slide there, you'll see all the training is free of charge. It's fully funded by the HSE. And all those wishing to register for training, whether it's online or in person, can book through the BookWin system, and the 2 links are there. So to organise in-house training, the cost of the training again is free, but we do ask for a minimum attendance of 20 participants. And I'm just going to speak briefly around the language around suicide. So we need to be mindful that many people here will have been impacted by suicide in some way, either personally or professionally. So it's really important that we always use sensitive and non-stigmatizing language when discussing suicide and self-harm. We should try to remain non-judgmental and try not to make assumptions about others. It's important not to identify a person solely by their mental health difficulty and never use a suicide as a noun to describe a person. And we should use neutral and simple terms. And one way to do this, if we are talking about suicide, would be to use the words die by suicide rather than committed suicide. And you'll see the other suggestions there as well. So I'm going to hand you over now to Patrick for the third key message.
Thank you, Rosaline. And the third key message is that someone is always there to listen. The HSE are funding a number of services and also provide a number of direct service to individuals who are impacted by self-harm and by suicide. The majority of individuals will get support from their family, from their friends, and from their local community. But the services that are provided by the HSE and funded by the HSE, I suppose the key part is that they're accessible, that they are locally based, and that they are appropriate services. And we have a number of services here that you can see that the community-based services, phone and online support, there's Childline, Samaritans, there's tech support, and there's other information can be sourced from mymind.org or turntome.org. One of the pieces in relation to the community-based services, such as the Samaritans and the tech support or Pieta, they provide services that are 24/7 and that they're available by phone and by text message. So therefore, an individual who may be experiencing issues in relation to self-harm or for suicide will be able to either make contact out of hours, at the weekend, bank holiday weekends, late into the night, and that they will get a response at that time from these services. And that can be a support, because as we know that the most crises don't happen between maybe Monday to Friday, 9 to 5. So it's important that there is the 24/7 support available, and the HSE is part funding those services in relation to that. For some individuals then, they may require to be assessed by a GP in terms of their in terms of self-harm and suicide, and therefore they might be linked into the primary care, which is a GP referral, or to the HSE psychology and counselling services, which are both referral through the GP. There's also, there's online support and phone support in relation to the Pieta crisis counselling, and the Pieta House SPLO service, which is the suicide liaison officer. It will also provide support to families who are impacted by suicide and also to community groups. The family resource centres also provide counselling services as well that can be accessed to people in the community, so that the local and sustainable services that an individual can avail of. And then where there is a higher complex need in terms of an individual, in terms of their period of assessment, or is linked to the GP, and then there has been referred on to the specialist mental health services where the assessment shows that there is a mental health illness and disorder, and that there is a level of risk attached to that individual, then they can be linked in with the specialist mental health services, and that's through adult mental health via GP referral, CAMS via GP referral, and the out of hours through NEDOC and MyDoc, or 999 and the emergency departments in the event of a crisis. Out of hours is available to everybody. And then in terms of, an individual may start with the universal needs, and their needs may be more complex, and they may require to come through the primary care and support and into the specialist mental health services. But it's also important in terms of the stepping down from specialist mental health services that an individual would be provided with the information around the various supports within their community, and that's accessible again 24/7 to them, that might help to support them at times when their mental health providers maybe aren't as available to them. And again, this information is kind of, I suppose, part of the resource officer role. And in order to get this information out into the community, there is a number of posters and postcards that are available from your local resource officer for suicide prevention. And then it is to get these information posters up where in your places of work, in your various services and within your organizations to highlight these numbers. And then in terms of the someone that always there to listen postcard for individuals. And what I would say, if an individual is struggling in terms of their mental health or in terms of self-harm or risk of suicide, then maybe it's not enough to just give them a card with a number on them. Maybe to support them to actually contact that service, send the first text message with them, ring the various services, and just to let them know that will they get talking to a person straight away, or will it be a kind of a phone line where they'll have to dial 1 for one service or dial 2 for another service, just so that in that moment, if it's late at night and that they're contacting that service expecting to talk to somebody and there isn't somebody there, they will know what that phone line is like. And I think that's an important piece for individuals who may struggle to engage with services. And then the National Office for Suicide Prevention, HSE, 50% of the budget goes towards our partner agencies, some of which are here today on the call. And I suppose that's an important piece of partnership working together. And, you know, all of these services are involved in various actions and will be part of the action plan going forward. But I think you can see from that, I know Josephine did the slide in relation to the priority groups. You can see how the priority groups are mirrored in the various services that are identified and funded here by HSE and by the NOSP office. Okay, key challenges, folks. Key challenges are training and resources. I suppose one of the pieces that we have been noticing is the difficulty in getting people to attend maybe the 2-day assist or any of our courses. We've had a number of courses that have been cancelled due to low numbers, despite, I suppose, all of the resource officers and various services highlighting the course. We had a recent course that we had 24 participants on, but on the day only 13 arrived. And that was even with a lot of work going on to people confirming that they are going to attend and taking people off the waiting list in order to make sure the numbers are there. So as Rosie would have said in her slide, that, you know, for any training, really we're looking for about 22 participants to engage in that, and particularly with the assist, because the group is divided into 2 groups during the course of the 2 days. So I suppose we need to look at that training piece. We need to look and see, well, look, are we meeting needs? You know, I suppose that feeds into our next key challenge, which is the post-COVID service provision. We're doing this launch online this morning, so apologies for any of our sort of glitches and different bits and pieces. I suppose we're getting used to delivering services in a different way, and we're getting used to new technology. And I suppose that is part of, you know, the challenges of going forward for the Connecting for Life, for the actions in terms of the implementation groups, for the working groups. How do groups meet? What is the availability of people? And we'll have to do some work on that. And then also in terms of accessing data and getting information to those who need it, you know, there is, Josephine alluded to the protocol in relation to the sharing of information around a suspected suicide within the community. And I suppose there is a difficulty at the moment in getting that support out to individuals and into families where if we don't have that information at hand. And also to get the data, we would see from some of our figures that we would feel that there's an under-reporting in terms of suicide, suspected suicides within the community. And I suppose it's important that we are getting the information on, you know, what's happening in our areas, so that we can get that information and support out to people, and then building on where there's extra support required, that we're able to link people in with the appropriate services, and that they're able to get a quality and professional response to their needs.